This video will give you a vision of what Smartline is going to provide into the future. It'll give snapshots of the research activity that's ongoing and show you how the data that's been collected can be used to improve health and well-being in the communities.
So one of the aspects that we're looking into is the relationship between people living in homes with visible mould growth. So this is anything growing on damp walls that could be anything from the size of your fist up to several metres wide in diameter, and how that mould growth and exposure to mould spores, for example, increases risk of asthma in older adults. So theme one involves around about 300 households who have had indoor sensors put in place to measure the amount of air pollutants, so interested in particulate matter and volatile organic compounds. And we're interested to see whether there's a correlation between increased air pollution and risk of asthma. So Smartline provides a real unique opportunity to explore in quite a lot of detail how exposures of those pollutants I've just mentioned vary within the home. So looking at how the amount of activity there are in those homes, the amount of time people spend inside, and how that influences both the concentrations of particulates and volatile organic compounds, but also risk of asthma in those residents. So far we've explored the relationship between older adults who we believe spend more time indoors and with thoughts that this increases exposures to biological factors such as increased mould growth, and we've found that those older adults living in social housing properties have an increased risk of asthma when they're exposed to a mouldy odour, which is present when you've got indoor mould growth, for example.
We're conducting what we're calling guided conversations with individuals in the community to see what their needs and wants are. One community, there was a need identified for a coffee morning. So we've been able to work with Volunteer Cornwall and with Coastline Housing to provide a coffee morning. People used to meet up in their local post office or in the pub and chat about their issues, and then that would lead to help coming from the community. Pubs and post offices are gradually closing. Can technology provide a bridge?
We're looking at data that have been collected across 300 homes in Cornwall, so electricity, water and gas. We've been using statistical and machine learning techniques to understand the relationships between the data that we have. So for example, looking at the electric use within a home. We've been working with 2 local businesses. The first one, we've been looking at their efficient hot water heating system, which not only heats hot water but also controls the heating system through radiators as well. The second company we've been working with is looking at smart controls within the home, so we can understand where savings might be made.
I work in public health, but also I work collaboratively with adult social care, for example, the housing sector. And this will help understand how different indoor environments, different housing stock influences health. And this will drive forward some of our local strategies around winter wellness, for example, and fuel poverty, and contributes to future ongoing work with the university and how we explore different factors that influence health outcomes locally.